All right, everybody, it's Dr. Kelly OMD. I am back. I'm a board certified OBGYN as well as a healthcare executive that focuses on helping women and their families live their healthiest and wealthiest life. And that is spiritually, physically, financially, and emotionally. And the way that we do that is through education, encouragement, and of course, inspiration. And the inspiration is with an E, on purpose. Tonight, I have one of my actual medical student classmates. We both went to the University of Chicago, and she is also a board certified OBGYN, but this woman is a double board certified physician because she is also board certified in reproductive endocrinology. And tonight she is going to talk to us about infertility. I like to call it fertility, as well as any other questions and answers you may have. So Dr. Baker, go ahead, tell us a little bit more about yourself and then take it away with your topic.
Well, thank you so much, Dr. Kelly O, for having me on your program today. I've been looking forward to this. So a little bit about myself. So my name is Dr. Marcia Baker. I'm a double board certified OBGYN, reproductive endocrinologist, and infertility specialist. I practice in Southern California. My practice specifically focuses around treatment and evaluation of female and male infertility. It encompasses all things related to hormonal abnormalities in women of reproductive age. In terms of practical aspects of my practice, I oversee treatment for couples who are going through intrauterine insemination, in vitro fertilization, third-party parenting. So the vast overview of all things related to fertility treatment. Now we're going to talk about some top 3 things that you should know, we should know as women about our bodies as it relates to fertility. Now, the list is actually more extensive than 3 things, but we're going to try to hone on just a couple of elements for the purposes of the program today, and just to get the conversation started. So one of the top things as women we should really, really focus on is getting to know our bodies. So today, fortunately, in this techie age, we have so many apps that are available, that are at our disposal, where we can track our menstrual cycles, we can learn about how frequent our menstrual cycles are happening. And then from all of that information, we can gather data and data points we can take back to our doctor if there are any concerns. If there are concerns about missing periods, skipping periods, heavy periods, all of those elements are really, really important in terms of getting to know your body. So one of the key elements I will say for women of reproductive age, get to know your body, get to know your menstrual cycles. And if there are any changes that seem abnormal or atypical for you, start having those conversations with your doctor sooner rather than later. And why is that? They can start pointing to important issues or diagnoses that really would benefit from early detection and early intervention. So that is so important to really get to know your body very well. If you have a cell phone, you can download an app and track your cycle. And even for those who are maybe technology averse, a daily planner or calendar can allow you to track your cycle and really get to know it in full detail. So that's number 1, get to know your body, get to know what it does on a monthly basis, understand your cycle. And if you identify anything that is atypical or abnormal, start having that conversation with your doctor early on. It can point to important hormonal issues that long term can impact or influence your future fertility. So that's number 1. Now, number 2 is age matters. So in this day and age, we tend to think that, you can get pregnant at any point in time. in terms of your reproductive lifespan. We see images on the cover of like celebrity magazines of different people getting pregnant later on in their 4th decade of life, or maybe even in their 5th decade of life. And it seems to happen with a lot of ease. But the reality is age is significant. In fact, it's probably the most significant factor as it relates to your fertility. What we know about age is that for patients in their, mid-30s, fertility starts to decline, and those fertility declines really pick up a lot of speed towards the late 30s and continue to accelerate quite rapidly in terms of the decline. So it's really critical, if you are a woman in your early 30s, to start thinking intentionally about what you want to do as far as your fertility journey. And so really start having that conversation with your primary care doctor, with your OBGYN. Be intentional about fertility planning as it relates to age. Oftentimes, when many of my patients come to see me, one of their major complaints is that these conversations about fertility just were not brought up until really later on in their reproductive lifespan. And so I say to you, know that age matters. And in your early 30s, if you are thinking about starting a family, start being more intentional. Go see your OBGYN, have that conversation. If you are thinking that maybe starting a family isn't the right time for you at this moment, then start having a conversation with your OBGYN about potentially getting to us, the reproductive endocrinologist and infertility specialist, so we can talk to you about options for preserving your fertility through egg freezing. So it's so important to be intentional about fertility planning and to always pay attention to age and the impact of age on fertility. So that's number 2. Number 3, we're going to talk about lifestyle. So I know, Kelly O, you are a lifestyle guru. You advocate healthy lifestyle and wellness for all of your listeners. And I'm here to say lifestyle does matter and make a difference. As you prepare for your fertility journey, you really want to be as healthy as you can be. So what does that mean? Taking an assessment of your weight. So if you are noticing, okay, based off of my weight, I may need to lose a few pounds. If you go see your doctor, they can calculate something called your body mass index and let you know which category of weight you're in, if you're normal weight, if you're overweight, if you're obese. Weight matters. And absolutely, as you are on this journey to really take control of your fertility, pay attention to that element of weight management, eating healthy, also exercising regularly if you're not on a regular exercise regimen. So weight matters. What other aspects of lifestyle matter? Well, other things like quitting smoking if you're a smoker, okay? Other elements too, like having a healthy diet. So what that means is cutting down on those bad trans fats, the processed foods, really looking critically at your diet and cutting out those elements that we know are not the best in terms of healthy options. So lifestyle really does make a difference. So just to summarize everything, number 1, know your body, know your menstrual cycle, download those apps and really get that information going. That way, if there's anything atypical or abnormal, you can fast track your way to your OBGYN. And then if they need to escalate concerns to us, you have rapid entry into our world. Number 2, age matters. be intentional about your fertility as it relates to age. If you are a woman in your early 30s, really start thinking about it seriously and planning, having those conversations with your OBGYN so that way they can essentially, escalate any concerns of interest to us. So you can have a fast track, to the infertility specialist if needed. And then lifestyle. This is the time to be the healthiest possible. You want to be healthy in body, mind, and spirit as you start this journey to parenthood, which in and of itself will take you through very interesting and wonderful challenges. And so it's so imperative to really focus on lifestyle. So those are the top 3 takeaways for our female listeners today. A lot of patients who come to see me often at times may not even be aware that there is an infertility specialist that they can see regarding their concerns. So I think it's important to know that the OBGYN landscape is very vast, and your entry point into learning about your fertility will start oftentimes with your primary care doctor, but the point of access usually tends to be your OBGYN. And so when you have those conversations with your general OBGYN, absolutely don't be afraid to ask if the conversations need to happen on a higher level with a fertility specialist. We are always available to patients to answer any questions that they may have. And so it's really important to know that we are here, we are available to answer those higher level concerns as they relate to your fertility.
Thank you so much for investing in our platform here at Vivalife. We're so happy to have you, and I hope that we can have you back sometime in May or June so we can do part 2 for the men's portion, and then we'll probably ask you for part 3 because we got to break down these medications that people are involved with. So thank you so much. Thank you. I so appreciate you, and I cannot wait to see you later on in May or June.
You are so welcome. Thank you for having me.
All right. Thank you, everybody, for coming on. It's Dr. Kelly, OMD, Vivalife. Have a wonderful evening, everybody. Vivalife. All right. Thank you for being a part of the Vivalife experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Vivalife.